put a casualty on a firm flat surface. Hello, hello, are you okay? Tap and shout. No? Hello, hello, are you okay? No response. Help, call ambulance 995, get AED. Alright, then open the casualty airway. Alright, you want me to say or just simply do?
Do.
Huh? Or say also, huh? Okay. Open the airway, okay, and then check breathing. Head tilt, chin lift for 10 seconds, alright? 10 seconds up, no breathing. Okay, locate landmark and start chest compression. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1 and 2 and 3 and 4 and 15, 1, 2 and 3 and 4 and 20, 1 and 2 and 3, 4 and 25, 1 and 2 and 3 and 4 and 30. One and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1, 2 and 3 and 4 and 15, 1 and 2 and 3, 4 and 50, 1 and 2 and 3 and 4 and 25, 1, 2 and 3 and 4 and 30. Okay, and we carry on, alright, until ambulance arrive or AED comes and is connected up or the casualty awakens. Alright, but if normally here continues CPR, so it continues on. No? So I position myself on this side. Okay, first I look out for AED danger, which is wet surface, metal, and flammable gas. Okay, they are all absent. And the next thing, I will put the AED here. It will be out of the way. Then this is the kit, that you maybe you position yourself in the correct angle. Chain and pendant, flip it to the back. Plaster. Remove it. Any chest hair, shave, we have a shaver. Okay, only the side where we want to put the AED pad, shave. And then if there is a pacemaker, now when we stick the pad, we will stick it. We will stick it about 8 cm away, which is approximately 4 finger space. Okay? And then wipe the sweat, finally. And after that, okay?
Applying the fibrillation pads, connect cable. 1, 2, 3, 4, 5, 1, 2, 3, 4. Analyzing hardware.
Can you stop CPR? Put the hand out. Stop CPR.
Shock advised. Stand clear. Shock now. Press the red button now.
For shocking, we don't look at the button and press. We look at the casualty. So nobody is there. Stand clear.
Shock delivered.
Okay, start CPR straight
It is
away.
safe to touch the patient. Begin CPR.
1, 2, 3, and 4, 5, and 1, 2, and 3, and 4, and 10, 1, and 2, and 3, and 4, and 15, 1, and 2, and 3, and 4, and 20, 1, and 2, and 3, and 4, and 25, 1, and 2, and 3, and 4, and 30.
1 blow, 2 blow.
1, 2, and 3, and 4, and 5, 1, and 2, and 3, and 4, and 10, 1, and 2, and 3, and 4, and 15, 1, and 2, and 3, and 4, and 20, 1, and 2, and 3, and 4, and 35, 1, and 2, and 3, and 4, and 30.
1 blow, 2 blow.
1 and 2 and 3 and 4 and 5. 1, 2 and 3 and 4 and 10 and 1 and 2 and 3 and 4 and 5 and 15. 1 and 2 and 3 and 4 and 20. 1 and 2 and 3 and 4 and 5, 2 and 3 and 4 and 30. So it's not enough.
CPR.
Okay, stop CPR.
Touch the patient. No shock advised. It is safe to touch the patient. Begin CPR.
Okay, check breathing. Alright, breathing present. Check for other injury. No other injury. Recovery position. Okay. So now we wait for the ambulance. And when the ambulance medic arrive, we will then yes, give a summary. We call documentation. Alright, so let's say he's a medic. So I will tell him the housekeeping. Okay. Now this shaver is a disposable one, so put a new one. Glove also, what is you throw away, put a new one, no? Okay. And then this one, the cloth also, put a new one, no? The scissor can be reused. Go and wash, sterilize it, clean, dry, and then put it back. So this kit of 4 items remains. And it is packed back into the, in case it's needed. And then we take a new set of pads. Now this is you don't remove the pad from the casualty when the ambulance sends him away. We leave it there. And if the ambulance has the same AED machine, they can just plug in and use. But if they have a different machine, they remove, throw away, put on the pad for the machine. Anyway, this cannot be further used once you remove. These are sticky pads. And you tear it out, you stick back, it won't stick well. No? So the contact is no good. So it's only used once. Okay? So that is so in other words, this thing goes with the machine with the casualty to the hospital, and whether they can use it or not, they decide. No, okay, it's gone already. Then here we need a new set of pads to be put in. No, so in training they will just remove this because in reality they were not brought away. No? So a new set of pads. No, okay, it has backing. So we take a new set of pads, then we check for expiry date. No? This is a shelf life item. Okay? So this is a new set that we have. Pack it back. Okay. Now put it into the pocket. No? And then pack it back. In the machine, we check the battery, that it is still okay according to the manufacturer's instruction at the back. Okay, this one can be put on standby, again where it's needed. So that is the whole sequence of the AED.
But in the event if the person is conscious, if he is awake after the AED,
then we stop.
We stop the AED.
Yeah, if revive already, we stop.
Okay.
No? But
once you open the eyes and responding to the news.
But then how do we remove the patch once it's awake? Are we supposed to remove the patch?
switch off the machine, pull out the plug.
No need to remove the pad.
Yeah?
No need to remove the pad.
I think it's best to leave it on. Reason is because
I think for that we once you awake then
anyway,
you
we
don't
wait for
so
the ambulance. I can help, or I know first aid. Can I help? Okay, you ask something like that, and you will note the aid. All right. So you move, then behind, help him. You see his feet is standing apart, and the helper also stand in a stable position. Move the two hands to the waist, hip here, center in the belly button. Alright, put the fist there with the palm inside, okay, and the thumb side of the fist. Alright, this way, bend him here, and then thrust, distinct thrust 5 times. 1, 2, 3, 4. Okay. So before 5 times already, he caught, the object comes out. Okay, and it's okay. Alright, but if not 5 times, arms horizontal under the armpit. Close it at the same level and then thrust. Okay? 1, 2, 3. Okay? Until 5. Huh?
Also, during on top also must do like 45
So you will notice I 5 get AED. We ask somebody to do it, no? Okay? And then position this casualty on a firm flat surface, straight away go into to do compression. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1, 2 and 3 and 4 and 50, 1 and 2 and 3 and 4 and 20 and 2 and 3 and 4 and 25, 1 and 2 and 3 and 4 and 30. And after that, now here is the difference. So in CPR we just blow. Here we check anything in the mouth. Are we successful? Anything comes out. If there is, I use a finger on the other hand, we say sweep it out. No blind sweep, which means you don't see anything, don't put your finger inside and probe. Okay? Alright, so if there is, I take it out. Huh? Okay. Then, after that, I'll check the breathing. Let's say no breathing. Alright? No breathing. There again, in CPR, no breathing, we compress. Here, no breathing, I blow. Okay, give a blow. Now let's say the chest don't rise. Chest don't rise means airway is blocked. What blocks it, I don't know. I have to confirm. So the standard practice is reposition the head. Bring it to the neutral position and then tilt it again. Head tilt, chin tilt. Then blow again. Now let's say the airway is clear, the chest rise. Okay? Then I blow a 3rd time. Blow again, no? A 3rd time. So I have 2nd and 3rd blow successful, 1st blow not successful. Which means that the airway is clear. When we have 2 blows successful, successive blow successful. You get it? Successive, successful. Then airway is clear. And it's okay already. No? The 1st blow was the blockage was from the tongue. Alright? The tongue blocks, not properly open, the airway. Okay. So after that, I will then want to know, should I do CPR? CPR is needed if the heart is not functioning. Otherwise, no need. So I check breathing. Okay. If breathing present, it's okay. If breathing absent, I do CPR. Alright? But if breathing present, I check for other injury, head to toe survey, no other injury, then recovery position. If there are injuries, I attend to them first and wait for the ambulance. So that is a little bit different on it. Okay. Hand palm upward, okay, under the thigh, or the body. Okay, then cross the leg, the far leg over the near leg. Okay, and then the arm, palm to palm, across the chest. Okay, protect the head, and then here have a good grip. Alright, either clothing or if not, just hold like this. If the clothing is too flimsy, and not like this, it may tear. So grab, that's a belt, grab. And 3rd, protect the head. Protect the head, yeah. Alright, now he's resting on the back of his hand, tilt it back, move this out slightly, bend. That's the recovery position.